Okay, so today is a very special podcast or session, whatever you call it, but it is on demand session. A lot of members of the ICU channel and ESBICM had mailed me, had posted in the comments that regarding MRCP, Member of Royal College of Physicians exam. They have asked a lot of questions how to prepare, what it is about, how we can do it, and how to prepare. There are n number of questions which they have posted and asked. So fortunately, today his guest is someone who is very much into this. He's I would say he's dedicated now totally in teaching regarding preparation of MRCP and other courses. And he's the founder of Intellect Medicos, Dr. Chirag Madaan. And he's a friend of mine, though we haven't met physically once, not even once, but we have been known for a longer period of time. And now we'll ask all the questions which you have posted. I have with me, I have noted it down. And with that, we welcome Dr. Chirag. Namaste, Dr. Chirag.
Hi, sir. Thank you so much for a very warm welcome. Thank you
Thank
so
you,
much.
thank you for
It's been
thank you for sparing time for us. And those who are listening, it's almost 12 to midnight in the night when we are recording this, and it's on a very short notice. He has spared time to give his valuable time and advice to us. Dr.
Sir,
Chirag.
I'm honored to be at your channel, which is ICU channel. And majority of my colleagues, my senior, my junior, they just follow Dr. Ankur, the ICU channel, ESBICM.
No, thanks a lot.
So you are
So,
you are the sensation now in the ICU channel and the ICU series, all those things.
no, thanks a lot for your words. And now from the ICU channel to MRCP. So I will ask all the questions regarding MRCP, but first of all,
Sure.
can you tell me a little bit about yourself to our audience or the members who are listening? Who is Dr. Chirag Madaan, and how did he jump to or switch over from a professional career as an intensivist to teaching in MRCP?
Okay, so if I tell about myself, sir, I graduated. My MBBS is from UCMS, which is a college in Delhi, and I finished my internship in 2012. And then we were the so-called guinea pig batch, right, where this NEET PG happened for the very first time.
Okay.
So we didn't have any clue कि क्या करना है, कैसा होगा, and all those things. We didn't have any clue. Then we went forward, and again the result came, and I was very much inclined towards medicine. I just wanted medicine. That was just my love, that yeah, I need to go ahead with medicine. But when the result came, my rank was around 2200 all India rank, and in the general category. So with that, I was not getting MD medicine in Delhi, which I wanted to. And but yeah, I was getting MD medicine in Assam or Bihar. But unfortunately, my father was against it, and he was like, "वहाँ जाएगा तो बिगड़ जाएगा." मतलब these are the kind of
Yeah.
intentions he had.
Far away
So
from home.
anyhow, जो गलत था कि दिल्ली में ज़्यादा बिगड़ती हूँ. So anyhow, the thing is, then what I gathered the information from my seniors, from my colleagues, that yeah, if you want to be in medicine, you can go ahead with critical care medicine via the route of anesthesia. And then I took that step because there's very less information nowadays. Yes, YouTube has much information, but I'm talking back 2013. So none of there were no videos, and there's no knowledge, and then you keep asking. And obviously in internship we just have just a 15 days posting, right? So we didn't have any kind of exposure to an anesthesia branch per se, I would say. And then I took that decision that why not, right? So I went ahead, loved the branch first of all. So it's a pretty awesome branch, by the way, and not that hectic. But still, the thing is, I wanted medicine. And the day I finished, and my MD is from Maulana Azad, that is in Delhi. And again, this is what I thought, and this is what my father wanted. Yes, he should be in Delhi, and that is why I selected Maulana Azad, which is so-called the best college in Delhi, having good exposure. Now, done that, right? After my internship, after my MD in anesthesia and critical care, I didn't do one day of SR-ship, not even a single day of SR-ship. I was totally dedicated and thinking towards going in critical care. Then I joined Apollo Hospital, which is in Sarita Vihar or Jasola in Delhi. And then I went ahead with which is called as IGCCM course for the critical care. And then I was like, yeah, I need to go with the DM in critical care or any other degree like fellowship. Although my one thing was DM. Then uh, what made the difference after my IDCCM? What happened is I got the opportunity, thankful to God and to my parents especially, that I was given the opportunity to head the ICU, right? And that is by the request from many consultants in neurology. When I was posted, and they were like, "Yes, we want Chirag as the ICU consultant and ICU head." So when that happened, I took that opportunity, and I was 31-year old then only.
Pretty
And
young.
obviously, you know about Apollo, sir. You are in Apollo, so many things, right? And it is not good to speak much over it, but
Hmm.
yeah, some other resistance which came, right? But I overcome that. And then I thought, now if I've secured this with a good position, with handsome salary, a brand name Apollo, now what? Should I go ahead with going with DM or any other thing? But what I thought and I felt was lacking is the diagnosis. I maybe, and I was good at resuscitating the patient, right? Which I got the response and the feedback from many others, but having good skills and all those things. But the point is, this is what I felt, that I'm still lacking in making a diagnosis. If a patient of pneumonia is coming, I can't say that, yeah, it can be Legionella or the mycoplasma or a normal or which lobe is involved and all those things, right? So
Yeah.
then one of my colleague in cardiology, he suggested, why don't you go ahead, if you have that kind of interest in medicine, why don't you go ahead with MRCP exam? And that is the first time I came across in 2019. From 2013 till 2019, I didn't have an idea. In fact, I had a
6 years.
misconception.
6 years.
Yeah, 6 years. And sir, एक notion है, this is a one notion in to the people, to the medicos, is MRCP is only made for MD people, which
Hmm.
is absolutely wrong. If a person has done MBBS and completed internship, he
Hmm.
or she is eligible to write MRCP exam. Now, with that, I went forward with this exam, and thankfully, I cleared it. And simultaneously, I was running my YouTube channel. I had this passion of teaching, right? So
Hmm.
I started back in 2017, and again, there were a few videos from where I got very pretty awesome comments, very fabulous comments, and many were the invitation from the consultants or the professors from different part of the world ki come and join us in our institute, in our hospital, and all those things. So it was a good one. And then I posted one video on my channel on Intellect Medicos, that how I cracked MRCP exam. Now
Okay.
with that changed. This was the time which changed everything actually. Right? I never thought that I'll be changing my profession from being a clinician to educator. Never ever. Right?
Hmm.
So with that, I just then I went ahead with part two and again cleared, thankfully. Then I thought, why not? If people want that help and if I have that passion of teaching, why not?
Hmm.
So that is how, sir. And but yeah, definitely, it was till date, this was the most difficult decision of my life, that I have to switch from which I never thought of, from being a clinician to educator.
So you
So
were
that was
work.
in just brief.
So it's a big step. You were working as an intensivist, and then you left the job, and now you are teaching full time.
Yes, sir. So initially, I started with one batch
Hmm.
simultaneously while I was working in the Apollo hospital,
Okay.
and I went ahead with that batch.
Hmm.
People cleared their examination, candidates, and I got a very pretty awesome feedback that yes, even though let's say some people were not able to, then
Hmm.
they were like, "Sir, this has changed our clinical practice. The
Okay.
way you taught, the way you did things, the concepts, and all those things, the mnemonics." And MCQs, so all those things have made a much difference in their clinical practice, and that gave me a push that yes, I can take that decision. And this time my parents were somewhat against that. Yeah, Apollo nahi chhodna, you can't leave Apollo.
Yeah.
So anyhow, this time I took that decision. Yeah, just give me 6 months. If at all I feel nahi, this is not I'm not getting that satisfaction, definitely I'll come back, or
Come back.
maybe joining Apollo if they agree, or maybe any other hospital.
So this shows your dedication towards teaching this course and other courses which we'll discuss. So So as you all have seen that Dr. Chirag is now completely teaching MRCP and other courses. So one thing, Dr. Chirag, many of the audience are already knew about MRCP, but some those who are listening for the first time, or those who are doing in the MBBS or equivalent courses or internship, can you tell me a little bit in short about what is MRCP per se? What is this exam regarding a brief intro regarding this?
So, sir, MRCP is basically it involves core medicine,
Hmm.
just the medicine. And it has three steps: part one, part two, and paces. Paces is a practical examination where you get clinical cases, and part one and part two are MCQ based exams
Hmm.
where you get in one single. If I talk about part one, you have two papers having 100 questions each, and similar is in the part two.
Hmm.
Part two have the image based questions, having all the radiology questions, let's say X-rays, ECGs, CT scans, which are very essential for any clinician. If you are working, if a person is working in emergency or maybe in a ward, he or she should know how to diagnose or how to check a pneumothorax on a X-ray, or maybe a bleed, hematoma on the CT. And this is what is being asked. And then in the paces, you have the practical exam. Now, this is about, if I talk about the exam, and it also have much relevance because you have to read just the medicine, no other things like biochemistry, micro, or forensic, nothing as like in NEET PG or a USMLE if you talk about.
Okay,
So
so
that is one thing which I also love, that yeah, it is just the core medicine which you need to concentrate.
okay, so what to summarize is basically MRCP is an UK based exam, and it's in the it's a member of Royal College of Physicians. Means you are going towards the
Yes.
medicine part. It has three parts: part one, part two, part three. As Dr. Chirag has said, part one, two is an MCQs. The pattern of MCQ changes in part one and part two. Part one is a, I will get breadth of the knowledge. Part two is the depth of the knowledge, and then your practical assessment is the paces.
True. True.
Now, while we are discussing all the question, we'll discuss all the questions regarding MRCP. Now, the point which is coming in my mind is the audience needs to understand why MRCP exam is important per se. Why we are talking about this exam so with so much passion. Why you are teaching it. How is changing the life. So why this exam becomes so important in the current scenario.
Now, sir, if you talk about a person or a doctor who is very much interested or inclined toward medicine, definitely it is very, very, very important exam. Firstly, it is recognized in many other countries.
Mm.
Definitely for UK, as it is a UK based exam. Second, Middle East. Then Australia, New Zealand. So there are many other countries. And
Mm.
then let's say you don't want to, or you don't want to go to another country. You want to practice in your country itself, and
Mm.
but unfortunately you were not able, if you are practicing in India, unfortunately you were not able to get that MD medicine seat,
Mm.
but still you wanted that, right? Then yes, you can have this MRCP, practice as your own OPD, having that confidence, not about writing that on the board, right, on your prescription letter. It gives that confidence because you have moved, you have read much things about, you have practiced question, and you have seen the cases also. For the cases, definitely you learn how you hear a murmur, how you hear lung sounds. So in this whole journey you learn a lot of things, and hence you get that kind of confidence. So first thing is, if you are practicing by yourself, you get that confidence. Second, if let's say you have done MD in any other specialty or even MD medicine, because in my batch many are the people who have done MDs in other specialties or maybe MD medicine or just MBBS,
Mm.
or I would say it boosts your CV, your resume, apart from confidence. Because first thing I always say that you get that confidence of managing a patient in a better way,
Mm.
and secondly it boosts your CV if let's say you don't want to fly abroad.
Okay, so what we can make out that this is a very recognized exam, not only in India but also abroad, including UK, Gulf, Australia, New Zealand, wherever. So whenever you say that you have clear an MRCP, the student gets the person gets an idea that he has a particular set of standard in the education part, and it opens up a lot of job opportunities and also the confidence in doing the personalized or private practice also. So
True.
that's fine. So now, Dr. Chirag, we have discussed about what I say, the MRCP exam. why it is important. Now you have told that MBBS students or after MBBS people can give exam, but I want to know from you again, what is the eligibility criteria for giving an MRCP?
So again, the same as you rightly mentioned, is a person who have cleared MBBS, has passed MBBS and done 1 year of internship, or what they write on their website is clinical rotation. So internship is also considered as clinical rotation of 1 year.
Hmm.
After that, yes, you are eligible. Once you have finished your internship, 1 year of clinical rotation, after that you are eligible to write the exam, to register for the exam.
Okay, so means after internship one can give exam, and obviously after MD and any specialty they can give.
Yes.
You have cleared your basic
Yes.
graduation in medical science, so that's
Yes.
a very
Yes.
important fact. I think people should understand this. Now, um, as we have discussed, it has three parts: part one, part two, and pieces. Part one is MCQ, which is the breadth of the knowledge. Part two is the depth of the knowledge, which means clinical cases, questions are there, and part three is the practical ones. Now, do we need to? Can we give this exam from India, or we need to go abroad for this giving this exam?
Yes, sir. This is also a frequently asked question. So all the three parts, part one, part two paces, all the three you can give in your own country. And especially if I talk about India, we have 7 centers.
For
So, and there are many centers in different part of the world.
hmm.
Gulf, there are many centers. Pakistan, Bangladesh, Sri Lanka, India, many centers.
Okay, so that's nice. And now, how many attempts are allowed for giving each individual part one, part two, and pieces? How many attempts are allowed, and within how much duration we can give them?
Okay, so sir, if I talk about the number of attempts of one part, it is the maximum is 6.
Hmm.
Although whenever a person calls me up and asks this question, I say, do not think about, just think about that you will be clearing this exam in your very first attempt. That is the mindset you need to have. But yes, as you asked, the number of attempts is 6, and the bar, initially there was a bar of 7 years, that from part 1 to paces it was 7 years, but now it has been removed last year itself. So there is no limit. I mean, let's say you clear your exam this year 2025, there's no
Okay.
limit. You can clear your part 2 other paces maybe in 2030 or 2035, but lesser the timed interval, the better it is.
The candidate is more in touch with the preparations and all those things.
Yes, yes, true, true,
So,
true.
don't get. I hope you are having a few minutes, 15, 20 minutes more, because I have a set of questions which the candidates have
Sure, sir,
asked to me.
would love to.
Ah,
Sure, would love to. Yes.
so we have discussed that. Anything about the syllabus you want to comment? What is the syllabus which MRCP covers? It's just the medicine or
Yes,
all the
sir.
branches?
Yeah, so all the units of medicine, which is cardiology, pulmonology, neurology,
Hmm.
endocrine, gastro, hematology, rheumatology, infectious disease, pharmacology, and then add-ons is dermatology, psychiatry, and ophthalmology. Also, there is something called as biostats and or the clinical sciences and biostats. So
Okay.
minors and biostats, these are also there. But yes, if you are good in all the units of medicine, definitely that is what is required. And that is not, I would say, in part one, they don't go in much depth. As you rightly mentioned, in part two, they go in slight depth, right? But part one, yes, very superficial, that you should be knowing. If you are what they test actually in the exam is, are you a safe doctor to work in the NHS or not? NHS is in the UK. So are you a safe doctor? So if you know these things, let's say how a patient of let's say adult cardiac arrest comes, right? There's a scenario, so you need to know what are the differential. What about HOCM? What about Brugada syndrome or ARVC? So whatever the question are asked, usually they have that implication, and that improves your clinical management also.
Okay. So now we know the exam. What I would like to ask now, those who many of the audience or the members are doing a job right now in the intensive care, or especially the audience of the IC channel. Many of them are preparing for the intensive care course, or working as an intensive or ICU residents in their respective hospitals, and some are preparing for different exam, or some are there in the graduation phase. So my question is whether they can do it while continuing with the job, or they need to leave the job and then dedicate their time for this exam. Is it possible for them to give while doing the job, especially?
Again, frequently asked question, and definitely this is very, very, very doable. And I have seen, I have instructed, I have helped many candidates, many doctors who are working, right? And majority, I would say 95% are the people who are working. 5% are the ones who are thinking about switching a job, and then they are like, let's go, can we go with this exam?
Hmm.
But it's not essential that yeah, you have to leave your job or take all the leaves for 3 months or 2 months or a month. No, so you can, but again, what is needed is the persistence. If you have that consistency, you are going with a continuous flow, giving every day on a daily basis around 3 hours, that is a minimum, around 3 hours, and then yes, you can. Then the other thing which matters is how are you doing that hard work.
Hmm.
So it's not just the hard work, it is the way you are doing that hard work. That should be a smarter way. If you know the things which are to be read for the exam, for this particular exam, then obviously it becomes easy. If you are just going randomly with all the medicine, obviously medicine is never ending branch, right? You cannot limit it. It doesn't have any boundaries. It's infinite, so you cannot, right? But if you know that this is the topic which has been repeatedly asked in the exam, then yes, it becomes easy.
So Chirag, Dr. Chirag, so coming to the one of the I think most sought section of this podcast is how to prepare for this exam and what are the challenges which we face. What are the challenges a candidate can face while preparation of the exam? So I want to request you to give a little bit in detail insights about this. How to prepare? What are the resources? What are the question banks available? How to go about it? All, please enlighten us.
Okay, so again, a very frequently asked question, that how to prepare. Now comes the role of preparing for the examination. Definitely, you need to have some basics about medicine, right? It's not that you need to have that. Yeah, you have read medicine in your final year or your internship. Nothing. So now one thing required is dedication, your determination, and secondly, now you have to go with the resources. The resources which are available on the internet are the question banks. Especially if I talk about myself, I did pass test at my time and 2019 and 2022, uh, because once I cleared my part one in
just
2019
to
and did
just
part
to
two.
interrupt just to interrupt so you did pass test while your preparation, and when we are talking right now, you are the course director at pass test of, I
Yeah,
think there is only one course
actually,
director right now, and you are the course director. So it's a
yeah, yeah, yeah.
the leap journey of the leap shows that how dedication towards this passion evolves and where you have reached. So those who are listening, Dr. Chirag is now as the course director at pass test. So now,
Thank you, sir.
please
So
continue.
that's yes. Fortunately, yes, they have given this opportunity of being the course director at the Pastors, which is, I mean, they are the pretty awesome team. And then yes, we have went ahead with the courses and different other things. Now, so what I was talking about is first of all the question bank, which I believe very good one is Pass Test. Second in the market is Pass Medicine. Third is the BMG on exam. So these are the question banks. Now, with that, you need some kind of reference books, which is very essential when you are stuck, let's say, in a particular question, right? And you are having a controversy whether to go with this option or the other one. For that, I would say the best one is Davidson, second is Kumar and Clark's, and third is Oxford Medicine. But if you want to prepare and person is thinking about preparing for in next 3 months, definitely it is a very impractical goal. I would say that yeah, you will be able to finish have Davidson or a Kumar and Clark's. I mean, that can't be done with a full time job. Now with that, I would say, if you go ahead with questions with in the question bank, and wherever you stuck, then yes, then only refer. But the problem is people, they spend much time searching on the internet. that yeah, what are the new guidelines, what is the latest nice guidelines, which is very important for the exam. Then what are the review articles saying, what is Oxford Medicine saying. So that is the problem in the system, and that actually what motivated me to just dive into this, that why not, there is nothing, I mean, question bank and the reference book, there is nothing in between, there's no association,
Mm.
that how to know about a theory, because moving on to a question sometimes is very difficult. You just have bombardment of questions, right? Just this is a fire going on, right? Or a bullets onto you, that
Mm.
what is HOCM, what is AF, what is murmur, how the murmur of HOCM behaves. So but if you don't know the basic, if you don't know the theory, then it becomes very difficult to match. So
Okay.
now, and that is why this intellect medicos came in the picture. That yeah, I'll be helping. What is the concept? What are the frequently asked questions, and how to approach those questions, and having some kind of mnemonics also, and then assessing yourself. How are you preparing with the mock test? Because once you are preparing for with the question banks, it's just like a lonely journey. Not many people they go with MRCP exam, right? And
Mm.
then you cannot analyze yourself. How are you performing? Is scoring 60% in a question bank is good enough? Will you be able to clear the exam or not? You don't have the answer. But
Mm.
if you have a people, if a bunch of people are preparing for the same exam, as like in my batch, we usually have a batch of 80 to 100 candidates. Now with that, when you go with a mock exam, you tend to see,
Mm.
are you in the first 10 or maybe 30th or maybe 50th. So you tend to analyze yourself that yes, if you are on the 50th rank, you definitely need to work hard, and you cannot go with this exam. You have to delay, you have to either increase your pace or you have to delay. So that is what I can answer for your question,
Okay, so
Dr.
means we have the question banks which you have enumerated. I would not say suggested, but these are the options available. So one
Yes,
can choose one of them, one of the question bank,
yes.
start preparing, then review the textbook if the time permits. But if you want to speed up. By speed up, Dr. Chirag, can you tell for an average student, like suppose take my example, if I want to prepare for an MRCP, I am a very average sort of guy, you in terms of, because my all focus in intensive care. If you ask me regarding intensive care, it would be pretty easy for me to
Hmm.
prepare for some exam or crack it. But now if I need to shift from intensive care to a different
Hmm.
field like pure medicine, or
Hmm.
suppose a person who is new like MBBS or doing a
Hmm.
certain different specialty, if he or she needs to think of start preparing, how much duration is fair enough if one goes by question bank and theory, and what difference this course will make if, in speeding up, which you have prepared, which you have designed.
So again, the thing is, there's a deficiency, I would say, or there's a loophole, that yeah, there's no one to explain the concept. Why are you learning? What is the concept behind that pathophysiology or that disease per se, right? Now, if you try to understand, definitely you need 9 months to 12 months, maybe a year or two, right?
Mm,
Understanding things.
mm,
Or let's say if I concise this, right, and I talk about in a period of 1 day. So if you are reading a topic and you are spending 3 hours understanding what are the causes of sudden cardiac arrest and going to the pathophysiology, but let's say, and what I have done is concise the thing, and this is what I do in my YouTube channel also, sir. If you
mm.
I know you have seen that also. So
The
on
Dr.
intellect medicals.
Chirag's YouTube channel is the same name. It's very big channel. The Intellect Medicos. No, I think that's the only name. And then the website
Yes,
where you
yes,
can find all the courses is also intellectmedicos.com. So it's a pretty
yes.
old channel. ICU channel is a pretty new one as compared to
Mm.
that.
So, sir, with that, if I talk about that gap in between the theory and the MCQ, that is what I am trying to bridge,
Mm,
and then people can relate. And then, if you are getting that information, if let's say you are spending 3 hours understanding a whole topic, and
mm,
you are getting that concise information which is being asked in the exam, no altu faltu cheese, just the important, just the pure value which is being repeatedly asked in the exam,
mm,
that is what matters. If you have got that in a span of half an hour, definitely what you have saved is 2.5 hours on a daily basis, I mean. And if you actually pura agar kar doge, to definitely you are saving your time, and hence can speed up your process in approaching this kind of exam.
So means if one, so we took it two scenarios. One is your question bank and the reference books. So for that, 6 months would be enough, or at least a little bit more when the intellect medicos was not there. So how much was the average time for preparation? You would have considered enough. 6 months, some 6 or 7 or 8 months.
Sir, again it depends. Let's say a person is spending quality time, right, not quantity, right, कि हाँ मैंने दिन में 5 घंटे पढ़ा, but 5 घंटे में से क्या था, there was a much of Instagram reels, right, much of Instagram scrolling through, or YouTube and all. But
Hmm.
if a person is dedicated and spending 3 to 4 hours on a daily basis, then yes, 3 months is sufficient. But if and in the second month you have to increase to 5 or 6 hours, and then later on, just before the exam, again you have to increase that. But let's say you just have 2 hours on a daily basis, I would say set the time frame as 6 months window.
Okay.
That is, I believe, is the most practical thing, because we need to have practical goals in front of us rather than going impractical कि हाँ ये हो जाएगा and all those things. So I don't believe that. We need to always have short goals and the practical goals.
Okay. So will as we are discussing your course, which is a bridge between the extremes. One is just the question bank, and the other one is the reference books, which is a lot of theory. And the course comes in between, which you have designed based on your experience, and it is now helping out. So can you tell us in short what exactly this course offers to the students? Means just the theory part, the classes, or there are some mocks or something. What are the extra, or you would say the USP of this course which you have designed, which is helping out so many people?
Okay, so regarding that, if I talk about, sir, first of all, whenever a person joins, you get the theory session. My week starts, you get a strategy that these are the weeks. This is a division of the weeks, right? First week cardiology, then pulmonology, then neurology. In that particular week of cardiology, let's say. So
Hmm.
first thing you get is a theory.
Hmm.
So what is the theory? What are the topics? What is the concept behind that? And then the whole week you can practice those questions. On Saturday what I have is a PYQ, or a previous year question discussion, so that a person tends to know that yeah, these are the questions being asked in the recent exams, and hence are very important, because MRCP, they are best in just molding the question, but topic almost remains the same. So then that PYQ is very essential, and we discuss about the approach towards a particular question, and also helping with the certain kind of mnemonics, because it is sometimes impractical to remember everything, right? So you need to have either the concept or the mnemonics. And then at the end of the week, on Sunday, we have a mock exam, which is again just as a similar examination, having it is on our application, having people can flag those questions, and once you submit, it is of 1 hour 15 minutes. Once you submit, having 50 questions, when you submit, you get your score and the rank, which is very very important for a person to understand how he or she is performing. Until as you don't have that analysis, I mean, that doesn't give you a push, that doesn't give you the real scenario. Then you are in a fake world, having a pseudo conference, or let's say you are doing good, a person is doing pretty good, scoring 70% on either of the question bank, pass test or pass medicine or BMJ. So then yes, that can be done, but still you are not seeing how others are performing. So that is the structure. And then in between, after 3 weeks, we have revision sessions, because many a times people have that habit, हाँ, पढ़ लिया, we have completed, and now jump onto the next unit and next unit and next unit, but they don't revise. So we have revision sessions also.
Okay, so Dr. Chirag, I was going through the structure of your course, and it was written live classes. So do you have a pre-recorded sessions, or you take live classes also in the in your courses?
Okay, so if I talk about the structure, on the one day, let's say if we have a cardiology week, on one day, on the first day, that is on Monday, the people get recordings of the theory session, which they can
चिराग
watch
रुकना
at their
पड़ेगा,
own.
माइक डिस्टर्ब हुआ है, इसकी आवाज कम आ रही है.
मेरे वाले की
हाँ, थोड़ी सी आवाज कम आ रही है.
ग्रीन लाइट तो इसमें अभी आ रही है, जो पहले आ रही थी.
हाँ, नहीं आ
एक
रही
तो
है,
चेंज.
मतलब या तो डिस्टेंस बढ़ गया है,
अच्छा.
या माइक
अच्छा,
का मुंह की तरफ.
ठीक है, मैं ऐसे बोलूँ. हाँ, ठीक है, ठीक है, ठीक है.
इतने ये थोड़ा ज्यादा क्लोज हो गया, तो इसको
अभी
यहाँ से
अभी
यहाँ
ठीक
से.
है. अभी ठीक है. अब ठीक
हाँ
है, ये
ठीक।
मैं शायद स्लो बोला इसलिए आपको ऐसा लगा होगा, स्लो
हाँ,
बोला मैंने शायद।
या तो हाँ वो डिस्टेंस वैसे ही रख लो, थोड़ा सा जोर से बोलना चलेगा,
ठीक है ठीक है ठीक
है
है
ना?
ठीक है।
ओके। Okay, so Dr. Chirag, I was going through the structure of your course, and in it is written live classes are also there. So my question is, in your sessions, do you have pre-recorded lectures, or you take live section or interact with the students also?
Okay, sir. As I mentioned earlier, that first of all they get a full schedule, and let's say it's about a cardiology week. On Monday, they get a recordings of cardiology,
Hmm.
and that they can watch on their own according to their time comfortability, or you can say time flexibility.
Hmm.
With that, this whole week from Monday till Friday, or you can say Saturday evening, they have to practice the questions. On Saturday, we have the live session. Now, this live session will be in the evening, 7 to 11 p.m. Indian time. And once it is done, let's say we finish our session at 11 p.m. After 3 or 4 hours, it is uploaded on our application. And a person who is not able to attend the live session can view that recording of the same day, and hence is the same with the another session on Monday on Sunday, where a person has to go with a mock test first of all, which is 1 hour 15 minutes or 1 hour 30 minutes.
Hmm.
Later on we have a discussion of 3 hours. So then the session on Sunday again ends around 11:30 at night, and after 3 or 4 hours it is uploaded on our application. So hence now this whole structure, people, I mean a person who is not able to attend because of time zone difference or because of hectic schedule, they can watch the recording.
So I want to ask one question, one thing which I'm very curious now. So we have listened that there is an MRCP preparation. The something is like going to the question bank, solving the question bank, practicing the question bank, and going to the theory part for reading. And in between there was nothing, a sort of bridge which can squeeze the time or which can give the relevant information like that which you design. Now my question is, and that there is live sessions recorded whatever this you have prepared. So can you share some stories or some examples how this has helped, and which you have actually seen that this has brought a change in the students? They were struggling or they were preparing, and this has helped them a lot. Some stories which we our audience can would like to listen to them.
So, sir, there are many, many, not one, not 10, there are many. And I'll just talk in this session about the extremes, right? One is a person who is 53 years, and I have uploaded that video on my YouTube channel also, about Dr. Indu. And the caption, the title is Age is Just a Number. And she is 53 or 54 years now. And at this age, she cleared all the three parts, part one, part two, and paces in first attempt itself. And what she said that she was procrastinating and delaying this exam for past 10 years. And now so she has successfully done it. And she always say that yeah, it is the motivation and the direction and the concepts, all those things. And she have talked about that on our video.
So
The other
she
extreme I would say,
okay.
yeah.
So she prepared. Started giving the exam at the age of 54, or she was doing in from before and cracked now.
No, so first attempt was at 53 years, and she
Okay,
joined my batch for 6 months, three months and 3 months. So she took two batches, and then she went ahead with the exam.
okay. So you
And
were
the
talking.
clear part one, she was in my part one batch, and she was also in my part two batch also for MRCP part two. And both the exams she cleared with amazing marks, first of all, and that too in the very first attempt.
Okay, you were talking about some other extreme also. I interrupted in between.
Yes, the other extreme, yes. The other extreme I would say is Dr. Arvind, and there are many other also. But Dr. Arvind has cracked all the three parts in 1 year, first of all, first attempt, part one, part two paces, and that too just after internship. He completed his internship in 2023,
Hmm.
and in 2024 he completed all the three parts of MRCP. And what he used to say that all the consultant were saying it is impossible, you cannot go ahead, you don't have experience, you have not seen much patients, definitely it is impossible, near to impossible, and all those things. And then what he always keeps saying, sir, it was you who mentioned that yes, it is possible. And he obviously it's his hard work, right? So he made it possible. So these are the two, and then there are many who cracked, who gave 5 attempts, 5 negative attempts, right? They were not able to clear it, and they cleared in the last attempt, which is the sixth attempt. They joined after the fifth attempt, that, sir, we are not able to, we are struggling, and we are so demotivated that we cannot
Yeah,
move
yeah.
forward.
Mm.
We are thinking, should we change our stream, should we think of another exam, something like that. And then they cleared in the sixth attempt also. So there are many stories, sir.
So we have listened about you and your course, and so my question is, how to get enrolled to your courses? It's just by going on intellectmedicos.com.
Yes, sir. So there is my website, intellectmedicos.com. Over there, I have posted my number also, my WhatsApp number also. They just have to click over there, and there's a box where it is written as "Get the course" or "Purchase" or "Buy." Right now, they click on it, and definitely now, if I think if the people who are watching from your channel, ESBICM, or I can say the ICU channel, then yes, what I can go forward is a discount code for them,
Arey wah.
which is
Thank you. Thank you. Thanks a
so
lot.
yes, because I thought ki why not, right? If I have come on your channel, it's an honor for me. So definitely I'll regard all the audience from your channel,
Same
sir.
here, same here, same here. Um, uh, so,
Sir, can you help me?
uh,
Code क्या रखें, क्योंकि I'll create that code. Will it
how
be good to have? Yes,
how much discount you are
yes,
going to
yes,
give?
sir, £100, £100, which comes
100
out to
pounds.
be around 12,000 Indian rupees.
Okay, so 100 pounds. So you can just make it ESBICM 100, sort of.
Yeah, that would be good.
Keep it
That would be
simple.
good.
So those
Sure,
who are
sure, sure.
listening and watching this video, if you want to get enrolled for this course, and if you decide, go to intellectmedicos.com, and then apply. I think Dr. Chirag will do it in 1 or 2 days. ESBICM 100. I will.
Today itself, sir.
Okay, I'll mention that in the description also. So thank you, Dr. Chirag. It's a very
Sure,
pleasant gesture from you, and it's
sure.
it's an honor for us and our channel. So
Thank you, sir.
so what I could get from last 30 or 40 odd minutes is MRCP is a very recognized exam. It's an option for those who want to pursue medicine at whatever age they are. It's if there is a dream for them, they can do it. It gives a global recognition. Um, One aspect I would also like to have a view of you on this, that post graduation, for doing a post graduation, especially in India, they need to crack NEET sort of entrance exam, and if they get a government college, that's something which is very good. But if they get a private
True.
colleges, not many of them are affordable sort of thing. There's a challenging to arrange the finances for that, as in the current scenario. I think this is a great option for them also. What's your say on this?
True, sir. Very true. In fact, I have many candidates who were willing to go with private colleges and having that MD medicine seat. And you know the scenario in today's time in India, it's pretty costly, very high cost. So then, and the exposure in those hospitals, in the private hospital, I would say is relatively less than the government hospital. Yes,
Sure.
in a government hospital, you good exposure and you train yourself, you get that knowledge, you get that skill. But in a private, having that amount invested for those many years and where you're not getting that exposure, I would say uh, that's not a good path. This is what I feel. If you don't have plenty, right, agar bahut hai, then yes. But
Yeah,
yeah,
but
if you think about,
for those candidates, this is a sweet spot where they can pursue this. They can join
yes, yes,
some institute, continue their practice, and then in between they can give this exam. And I
a
think,
minimal,
hmm,
amount, sir. Let's say if I talk about part one, it is 616 pounds, right? Similar as the part two, and the part the basis is
very
1200
nominal
pounds.
as compared, very
Yes,
nominal as compared.
yes, yes.
So, and then for the preparation strategies, you told that anybody can prepare. They can choose any of the question banks, past test, past medicine, anything. In past test, you are the course director. They can do the
I would say it is the best. Although I'm a course director, it's not about because I'm a course director I'm saying, but yes, fastest is definitely very good.
Okay. So um, now, because we have discussed this thing, there is a always a query between past test and past medicine. So what I have understood, just correct me if I'm wrong. Past medicine give you the concept a little better, because on the question bank the descriptions of those questions are little better. But their question doesn't simulate the severity of the or the actual way the questions which are asked in the exam. While in past
True.
test, what you get is the explanation may not be that enough, but the questions are more or less similar to what you get in the exam. This is what I have made from all the things which are available. Am I correct?
Yes, sir. Very, very true. The framing of the questions in past test is pretty awesome. It is almost similar to what is being asked in the exam. And
Okay.
what is the problem? Past medicine definitely have good explanation. It has bullet points and all. No doubt in that. It has good explanation. But the the difficulty level of past medicine, I mean, there's no much difficulty level. It's very, very easy. It gives you a pseudo confidence that yeah, you are performing good. If let's say you are scoring 65 in a particular unit, 65%, that person is getting that pseudo confidence that he or she is performing well. But if you see the actual scenario, the actual exam, it is way difficult than what is being shown in past medicine. So that is one thing I would say is which goes against past medicine. And here definitely past tests have pretty good questions.
But for starters, I think for beginners, past medicine is still it's a good choice. But having said that, we were discussing that question banks are there, and when you didn't understand the concept, you need to struggle with YouTube, you need to struggle with textbooks, you need to find the
Yes,
concepts,
true.
and that wastes time. I won't say it wastage of time, but it takes too much time, because once you have understood the
Yes,
concept, it's not a waste. But when you're preparing for a certain exam and you have a deadline, then you need to be a little bit masterly strategic in preparations, and that's what I feel you chip in. You have designed this 3 months 6 months courses for those things.
yes,
So
yes.
I think we have discussed a lot of things, but before ending, and thank you for your giving the discount coupon also to the audience which are seeing ESBICM 100 is the coupon name. You can go to intellectmedicos.com. Now, before closing, few tips, or I would say few words of wisdom or motivational thing which you can give to our audience which are listening, or the students who are thinking of preparing, or those who have prepared and failed in few attempts, and are again thought in mind whether we need to give it again or how we need to change the approach. Few words of wisdom for them.
Sure, sir. So, what I keep saying, success have three pillars, and very importantly, the first one is your determination. If you have that question in your mind that should I go with, let's say, a PLAB exam or AMC or USMLE or NEET PG, if you are still confused in your mind, definitely that is the main roadblock, and you will not be able to achieve that success, right? Because your mind is still diverted. So first you need to be determined that yes, I am going with this exam, I will clear this exam. I don't have that both the option or three options in front of you. Maybe I'll do this also, that also, and so you'll not be able to perform well in either of the exam. This is a common possibility. Now, second, what I say, second pillar is hard work, but it should be a smarter hard work. So you have to invest your time and efforts in a way that yes, it gives you and it provides much outcome. You cannot go ahead with reading the reference books or let's say up to date and all the review articles or all the nice guidelines. It takes hell lot of time. I mean, you need much time for your preparation, and then only let's say you have read all the reference books or all the nice guidelines, you'll not be able to revise whole of it because it is I mean, it is abundant, right?
Exhaustive.
So you
Exhaustive. Hmm.
exactly, it is a very exhaustive and impractical, I would say.
Hmm.
And then you have to have a smarter hard work where you tend to know, yeah, these are the questions or the topics which are repeatedly asked in the exam, so you need to be thorough. It should be from A to Z. If this question has been asked, if a question about murmur is being asked, you need to know every different type of murmur, or let's say about a coarctation of aorta. You need to know how a patient presents, what are the different types, how to manage, what are the different presentations, so everything about it. A to Z if it has been asked in the exam, and then investing your time and practicing those questions from your question banks. And third, I would say, is definitely your luck, right? That is also, we cannot, I mean, everything is by God, but until unless you don't have that smart hard work, definitely God, your luck doesn't favor, right? So you have to. So these are the three things I would say, and it's not that difficult. It is doable. Many people in the past, many doctors in the past, just interns have cleared it. So why can't you, right? I mean, people who have experience, right? Definitely. And the person who is just completed internship, definitely. If other person have done it, why can't you? Or let's say people who have given the previous attempts were not able to because of some reason, some circumstances, they need to learn from their mistake. They previously, I did this mistake, I left, let's say, minor subjects, or I was not good in infectious disease, or let's say gastroenterology. I will put my more efforts in these units and also revise those units. So rather than being getting demotivated, they should learn from their mistake and hence go forward with the success. So this is, again, I would say, one line, it is much doable, and there are many many examples which I have from my previous batches.
Thank you, Dr. Chirag, for sparing time. It's almost 2 in the night, in the Indian Standard Time, and thank you for your words. And very true. When I was preparing for EDIC, the same scenario happened, that it's very tough and all, and different strategies works, and that I share it,
Yes,
like that.
the
And
channel itself.
maybe sooner I will be teaching that also. Who knows?
Great. That would be great. And this is what I'm pushing you, sir. Please start karo, because people need that help, sir.
Hmm.
If you have, I mean, you have that passion, aap bhi padha rahe ho, and that is in a good way, right? You know how to explain things, you know how to simplify things. Then why not, sir? And seriously speaking, it gives a lot of satisfaction. पहले मुझे, I also had this doubt कि कैसा लगेगा and all those things. But now I feel this is the best feeling I had. Right? Obviously, saving a life is good, but you are training a person,
Who can
helping
say
him
it?
in his
Yeah.
case, and definitely he or she will save many other lives, right? तो आप और multiple हो गया.
And first of all, I would like to use your coupon code to start my preparations if I decide to for
अरे सर,
MRCP.
आपको need नहीं है.
Thank you, Chirag, for your time, and thank you for all the audience for giving us all the questions to ask from Dr. Chirag, and thank you for listening. Have a nice, I think, have a nice day, night, or afternoon, whatever you are, in whichever time zone you are, and best wishes. Good luck. If you want to, if you decide, you will definitely get it. Thank you, Chirag, and maybe we'll
So
invite
much.
you for another session on the channel very soon. Thank you.
Sure. Would love to,
Thank
definitely.
you.
Okay, bye bye. And
Bye
best
bye.
wishes to others.
Thank
Bye
you.
bye, sir.